The following program is an original production of WICC PBS Chicago.
Tonight, more than 7 million people have signed up for the Affordable Care Act, including over 300,000 in Illinois. With the deadline behind us, what's next?
The mayor in the hot seat. His new pension plan will make homeowners and city workers dig deeper into their pockets, but will the unions go along?
And asleep at the switch, the blame game intensifies over the O'Hare Blue Line train crash. All of those stories and more on In the Loop. Next up, Mayor Emanuel's solution to the city's pension problem is angering just about everyone. Here's the latest on that story and a look at other trending topics.
The mayor's plan for Chicago's pension time bomb. Taxpayers and city workers will share the pain.
This achieves the goal of guaranteeing that people will get a pension, and to do it in a way that is responsible and also removes the biggest cloud over the city's economic future.
But will the public employee unions go along?
With public employees, there's a promise made because people give up, the ability to earn corporate-sized salaries in return for a kind of security that doesn't come with other employment.
Who's to blame for that Blue Line crash at O'Hare Airport? The union argues the driver was overworked, but she had dozed off before on the job. Who's protecting the passengers?
If it's a budget problem, this is the price you pay. It's a tough price. It seems to me it was just very lucky it happened at 3 in the morning. Otherwise, people would have been killed.
Fighting the flu, jet-lagged, or suffering from a hangover, a Chicago clinic promises a fast recovery for a price.
It's not something I would necessarily do, but sounds like a good idea.
And our guests today are full of energy. Joining me are journalist and TV personality Daryl Denard, Amisha Patel, Executive Director of the Grassroots Collaborative, and Mark Brown, columnist for the Chicago Sun-Times. Welcome, everybody.
Thank you.
So we've been hearing about health care, and no question the rollout was a disaster. Has anybody changed their mind about the program since it started?
I don't know about changing minds. I do think that the message is starting to solidify, and when people were starting to look at that deadline and they didn't have health insurance, they realized that maybe this is something I want to take advantage of, and that's why I think you saw this last-minute surge of people signing up, because they said, well, do I want to pay that penalty at the end of the year? At the very least, it's going to be $95, or if I'm making some real money and I'm not insured, it's going to be 1% of my income. So weighing that against not having health insurance was probably one of the determining factors that said, I might as well.
But was it too little too late, as we heard suggested earlier today?
Well, we're one of the organizations that was doing outreach around the Affordable Care Act, and it made a difference to be talking to folks door to door. I think that we'll see again what the numbers roll out to be. Honestly, I think that there's a bigger question of how many people still remain uninsured, and do we actually need single payer as a solution to address the health care issues in this country? But I think it was absolutely clear that the outreach mattered. We talked to people who didn't know about it, didn't know how it worked, and that we were able to refer into enrolling into the Affordable Care Act.
Mark, what's your take? Do you see it as an improvement, even if it's an incremental one?
I'm one of these people who has wanted this to work desperately. And you asked the question, has it changed anybody's minds? Unfortunately, I'm hearing from people who are Obama supporters who wanted this to work, who are in this market and go, geez, this doesn't work for me. And so I am still worried about whether overall it's going to work. I think everybody knows that it could be improved, but with the political climate, we can't get our heads together to do that.
On that political climate, if you look at the polls, Republicans overwhelmingly want Obamacare repealed. They'll vote for congressional candidates who feel that way. Democrats want it protected and saved. Do you see this as the big issue in the midterm congressional elections this fall?
I think that it's going to subside, and if the numbers continue to increase, especially those that were afforded the opportunity that during that last-minute surge that signed up with the extension to still go into the marketplace, latest polls that I heard as early as this morning were that people are starting to have a much more positive to neutral opinion of it, as opposed to the very derisive opinion that they had.
But it's a very
just months
divided
before.
opinion.
It is.
Between Republican and Democrat. I mean, it's very, very stark, Amisha.
Yes, and I think actually, to me, I agree. I don't actually know how much this is going to still be the hot issue when it comes to the elections. I think honestly, the question around jobs and what's happening and how are we creating jobs remains to be the key thing that folks on either side of the aisle are concerned about.
We have a big political issue here in the city of Chicago, and that is the pension time bomb that we heard about a minute ago. Rahm Emanuel, the mayor, has got a big pension problem, and this chart that we're going to show you explains exactly why. The pension debt per every man, woman, and child in the city of Chicago is just about $19,000. That's almost double New York City, and it's triple the pension debt for Los Angeles. So, Mark, do you think that the plan the mayor has put forward, do you think it's a good one?
I think it's a responsible plan. I know it's painful. I know it's going to be unpopular all across the board. But you know, you just spelled out the numbers. We got to start dealing with it. And a plan that takes some of the money away from the pensions, a plan that makes the taxpayers start ponying up what they probably should have been ponying up all along, and that Mayor Daley ignored. I think this is the outline of what we got to do. And I mean, we still got other shoes to fall that are going to make this even more painful.
Amisha, we are sharing the pain in this plan, apparently. The unions are going to have to pony up a little more for health coverage, and taxpayers are going to have to pay more in property tax.
So I actually don't think we're sharing the pain. I think that what the burden of the proposal really falls on are the workers. And I think if you look at what workers we're talking about, it matters. So we're talking about school assistants, we're talking about lunch ladies, custodian workers, folks who haven't made a lot in their working life, and certainly their retirement income is pretty modest. So and we're also talking about in the city of Chicago, most of these workers living on the south and west sides and being African American and being female. So when we talk about cutting pensions, we're actually talking about taking money from neighborhoods that have already been disinvested from, that have lost schools, that have lost mental health clinics, that were places where jobs aren't located. So the impact in terms of the economy in the city is actually going to be devastating.
Well, I mean, just to be fair, and the mayor points out that he's not cutting pensions, he's asking workers to contribute more, which is something different. Darrell?
I think that what he's trying to do is sort of spread the bad tasting medicine. And when you look at the homeowners aspect of it, I guess during the first year, kicking in 2015, you're looking at an $85 increase per homeowner. And then it maxes out somewhere, I think, around $250 or $215. So it's a reality that we have to deal with. The fact of the matter is that if you continue to have dirty laundry, sooner or later, you're going to have to wash that laundry. And I think he's trying to do an approach where it's a shared burden, because there are people that, you know, don't involve themselves in pension plans, but yet because of the state's requirement of having to feed those pension plans much more so than other states, you got this major deficit.
But I think we have to look at look at priorities in the state and who are we asking to contribute and who are we not. So for example, we continue to have all these loopholes for folks who are wealthy in terms of not paying their fair share in taxes. We continue to give huge numbers of money in corporate subsidies, corporations that are doing just fine. That's the use of our tax dollars that instead could be going to shoring up pensions, to reinvesting in public services in the city and the state. I think the tough choice is actually asking corporations to pay their fair share, not a $20,000 retiree to say, you need to pay more.
Well, I guess the mayor is facing a big time deadline because this stuff is coming due in the next few years. When we look at how this may affect the mayor's race, there's already been a poll out, and I know it's early, and the Cook County Board Chairman Tony Preckwinkle has not announced yet. A poll came out in the Illinois Observer suggesting that Preckwinkle is now leading the mayor should the election be held today. Is this surprising to anybody?
I was a little surprised that she'd be leading. I think would be a very formidable candidate, and And I think if she gets in there, that they would come at her very hard and they would even up those numbers pretty quickly. But I don't think she's really in a position to go out. I mean, I suppose there's some room here for somebody to come and demagogue the pension thing, but I don't, and the tax cut, the tax increases that are going to go with it. But I don't think she's that person.
The other issue, of course, is going to be the school closing. Do either of you see, or any of you see, Mayor Emanuel facing a tough reelection in 2015?
I think that probably the ace in the hole here, or the joker, is going to be the African American vote. And whether or not they decide, because they were the determining factor here in terms of Rahm's success.
Overwhelming support.
Exactly. And if those numbers erode, and then you have an attractive individual like Tony Preckwinkle that comes on the scene that still has the ability also to attract people outside of that community, then it could make for a very interesting race.
We were talking about unions a while ago and pensions. Another big union issue is the blame game now going on between the CTA union and the CTA over that accident on the Blue Line at O'Hare, which could have been much worse. Who is to blame in this? Can you sort that out?
Well, I think one of the things that is happening, and this is true for all workers, is that workers are being asked to do more and more with less and less. That's certainly true in the journalism business. It's certainly true in all kinds of work, right?
And we can fall asleep at the typewriters and nothing happens.
So that's the difference, right? So when you cut back on public services, there is an impact on the public, right? So there's an impact on safety. There's an impact on the education of our children. When you've got 40 young people into a classroom, there's a very different impact. And I think this whole continual push of austerity, of cutting public sector jobs, of asking folks to do more with less, there's a huge impact on the community and our safety, on the quality of care and services, and the quality of life that people have. So absolutely, we have to look at what does it take to actually provide the services that folks depend on, and are we putting enough resources in? And I think it's pretty clear that we're not.
Mark Brown.
Well, it's unclear to me from those stories whether or not she was being pushed to work extra hours, or whether or not she just wanted the overtime. You know, and God bless her. I understand mistakes happen, but I come from a railroad family. When you're in the railroad business and you fall asleep, you're going to get fired. That's what happens.
And Darrell, who's protecting the passengers?
Well, that probably is a $64,000 question. In terms of protecting the passengers, kind of adding on to what Mark said, there had already been an incident before, if I'm not mistaken, where she had fallen asleep.
She admitted that, yes.
And missed the stop sign or something. Fortunately, there weren't any type of casualties or incidents that happened with that. But you have to really look at the quality of the individuals that you're hiring nowadays. And if that had happened, then, why wasn't she on a supervised run? Why was she? And arguably, it was a run early in the morning, so it wasn't, something that could have ended in catastrophic numbers had it been during rush hour. And that
Either way, it doesn't give riders a whole lot of confidence in the process. Finally, if you do need a pick-me-up after a rough night or the flu or too much to drink, there's a new clinic promising a speedy recovery. It's called IV Me in Old Town, and we're going to hear a bit from the medical director. His name is Dr. Jack Dybus.
Mostly it's people who are sick, cold and flu, and they need to bounce back right away. And with the fluids and the vitamins and everything, it helps you bounce back from that. A lot of high-end athletes. We had a professional football player in here yesterday. They get the fluids, they get all the vitamins, the antioxidants that help them recover faster, help them work out more. We get travelers who are jet lagged, people traveling from all over the place. So, we do get some hangover people. And then the treatment usually lasts anywhere from 45 minutes to maybe an hour and a half, depending on how much fluids you get. And then we'll take the IV out and give you the instructions and send you on your way.
So would anybody pay $116 for this?
Well, I think this ties together a bunch of our issues from today. I think Amisha's folks would like to tax luxury services instead of property taxes. There is a tax. There's a service that I think we could all agree. Indeed. Just tax the hell out of whatever idiots have got the money to pay for that. And are they billing insurance for it?
Yes. Is it covered by Obamacare? That's what we want to know.
Well, and I think it's also. I think it's just telling that so what we need is something to help drunk people on the north side feel better. We don't have have a trauma center on the south side. Like when I'm talking about healthcare or meeting
puts things
people,
in
it's
really-
a bit of a problem.
in a
I
big
think
perspective.
Our priorities
So-
are off a little
So
here.
thank you very much. We have to wrap it up on that note. Daryl Denard, Amisha Patel, and Mark Brown, thanks for your time today.
Our guests will stay here and join us for In the Loop, the after show. You can also join the conversation. Simply log on to wycc.org and look for In the Loop. We'll be talking about the new Illinois concealed carry law, hundreds of applications rejected, and the first arrest for violating the new law.
That does it for this week's show. You are now In the Loop. I'm Chris Bury.
And I'm Barbara Pinto. Good night.